Let's talk about sex, baby. That's right, we're talking about sex today, and we're talking specifically about sex during perimenopause and when menopause finally happens. Some women report that it hurts when they have sex, some women can't get to orgasms, and some women are like, sex, forget about it, I don't even want to do it. There's a lot to cover, so let's just get right in. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? What can we learn from our poop? You gotta get that protein. Get that protein. Ladies, you need the protein. Do you think it's been exaggerated? If I have sex the night before my pap smear, can it mess up my results? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. All right, we're going to talk about sex after menopause today. My guest is Dr. Amantia Kennedy. She is an OBGYN and gynecologist with WakeMed. And this is a return visit. Thank you for not being afraid of us.
Oh, thank you for having me.
So I want to just jump right in with my first question, and I'm wearing glasses today because some days you need them and some days you don't. First of all, let's talk about the physical changes we can expect that will alter the experience of sex as we near menopause, which means perimenopause into menopause.
Yeah.
So what physical changes?
Yeah. Perimenopause transition and menopause, women will go through some physical changes, and they may go through a lot of physical changes, but not all women will have the same changes or experience it the same.
Okay.
So some of the changes that happen, perimenopause and menopause also coincides with aging.
Yes.
So weight gain is the most common complaint that women will have, especially with their
I have
bodies.
that complaint. It sucks. You don't change anything. And then all of a sudden you're 30 pounds heavier and you're like, what did I do?
Right. That's the most common complaint that women will have. And I always say, if you have a 20 or 30-year-old reunion for your high school reunion, you will see everybody's going to put some weight on. And that's age alone. But in transitioning to menopause, we also have diminished hormone production, like the sex hormones, estrogen, progesterone. And that causes the changes in our rapid muscle loss as well during this time, which causes even more net gain in addition to aging.
Okay.
So body image does change.
God, yes.
But certain women will have changes in their skin. Mm-hmm. Their skin will get drier. Let's say you had a combination or oily skin, and all of a sudden you're having to change your products because your skin is a little bit drier.
Okay.
The hair is a little bit thinner.
Everywhere, I'm assuming.
Everywhere. And also there are vaginal tissue changes that are occurring due to the decreased or diminished production of estrogen and progesterone.
How are they changing?
So estrogen plays a major role in the collagen production in the vaginal tissue.
Okay.
But not only the vagina, but also urinary system.
Urinary tract?
System. Yeah, okay. Urinary tract system. So the bladder, the urethra.
Interesting.
So, and also pelvic floor muscles. So women, as they transition or menopause and beyond, will have less elasticity in the vaginal tissue.
Oh, interesting.
Less lubrication, which in turn can make sex, and that's what we're going to talk about today, mainly a little bit more painful.
Right. And so that was I know that along with weight gain, which can also lead to, I would imagine, some problems in the bedroom with the self-esteem thing. But painful sex is a very common complaint. What can we do for it?
Well, there are multiple things that we can do for it, but one of the things that we can do for it is bring awareness, especially for the women that are listening right now, to know that you do not have to be suffering in silence. You can talk about it. We need to bring it up and be more aware. And you need to know that there are treatments.
Okay.
There are over-the-counter treatments like maintenance, like over-the-counter moisturizers that we can use on a regular basis. These are not just for sex. These are to maintain the plumpness, if you will, the water-based lubrication in the vaginal tissue. It does not correct for the collagen, diminished collagen production, but it can help maintain the moisture in the vaginal tissue so that you don't feel so dry or so irritated.
So what do these products look like on the shelves? What are they called?
They're called vaginal moisturizers, and there's multiple brands that have them. Some of them you're familiar with, and some of them you're not, but you can find them on Amazon. You can find them at the drugstore, and those look like suppositories.
Okay.
They're specifically for the vagina.
Okay.
We are so used to, as women, taking care of our face.
Oh, yes.
All of our lives. You moisturize it, putting makeup
keep them
on.
wrinkles at bay, girl.
Right?
Yes.
We just talked about this. So it's the same thing for the vaginal tissue. We just need to pay more attention to it.
Okay, just keep it moisturized like your face.
Keep it moisturizer, yeah.
Okay, well, I actually saw something on Instagram the other day that had me shook. And so it was someone was holding up a diagram of the lady bits on the outside, right? Your labia. And so the labia is the one that looks like a butterfly, right? The person on this video said that you grow the labia during puberty and it goes away during menopause. Is this true?
So you do lose the fat cells in the labia. So you do have a decrease in the labia during transition to menopause and beyond.
So does the butterfly like shrivel up and die? Is that what you're saying?
It does not die. It's still there, very much there, but we do lose some fatty tissue in the vaginal area, in the vulva area. That's what it's called.
Well, I just had to ask you that since we're talking about physical changes.
Yes.
And I saw that and I was like, what?
Yeah.
No. What?
It does.
No.
It changes. It's thinner.
What's the average age for menopause? And we're not talking little old grandmas here. These women are relatively vibrant and young.
Yeah, absolutely. The average woman reaching menopause in the United States is age 51.
Okay.
But women will enter perimenopause younger than that. And some women do experience physical changes during that transition as well. So that's important to recognize. But we do also know that women that reach menopause younger, for whether it's familial or medical conditions or treatments like a surgical treatment for endometriosis or cancer,
right.
Those women that enter menopause earlier, they suffer more significant changes at a younger age.
Right. We hear that lube is our friend. Let's just reiterate why lube is our friend.
Yeah. So we talked about vaginal thinning and dryness and sex becoming painful in menopause, and that is due to friction. So I always say to my patients, look, while we don't want wrinkles in our face, we do want wrinkles in the vagina.
Okay.
Because that's elastic. It stretches.
I see.
So in menopause, we lose that elasticity. We lose what we call the rugae, or those wrinkles in our inside the vaginal tissue. So friction with intercourse becomes more painful. A lot of times women will describe it as, it feels like sandpaper.
Oh, no.
It really does. So obviously providing lubrication, physics alone, friction will be better. Now, there are a lot of lubrications out there.
That was what I was going to ask you. Are there some better than others?
What we do recommend that are only water-based or silicone-based lubricants.
Okay.
You can use some oil-based lubricants as well, but they do have some, if you're using condoms with your partners, they do affect that.
That makes sense. Okay. Let's talk about the desire to have sex. How does that change in peri and menopause?
So as you can imagine, sex hormones do play a role in
And what are those hormones?
Estrogen, progesterone, testosterone.
Okay.
So a lot of times women will have not just a low desire, like I want, but also it can be associated with other symptoms like genital arousal, for instance, or orgasm, like I can't achieve orgasm at the same time that I used to before, or not at all for some women. And then painful sex is the other common symptom. But the desire to want, if it becomes a bothersome in your relationship, then it becomes a dysfunction.
Right.
And we know that most of the providers know that sexuality is an important part of quality of life for women, yet addressing sexual issues in menopause and beyond is under-evaluated and under-treated.
Shocking.
And I'll admit to that. It's both ways. It's from women not bringing it up, and then providers also feeling a little bit uncomfortable bringing it up, because not until now we have available medications that we can treat. Okay. But let's go back to the hypoactive sexual desire disorder that we call
hypoactive.
Hypoactive.
Po means less than. Per means
hypo means less. Hyper means too much.
Okay.
So there are multiple reasons that we need to address, right? Is it because of depression? Is it because of medications that you are on?
Right.
Is it because you're not sleeping well? Because, there's other things that are happening during this transition time.
Is it because of the crushing weight of reality?
Well, a lot of times women will say, well, it's aging. I'm just going to give it up. It's just what I'm supposed to do. And that's not the case.
That's sad.
That is sad because, studies over and over has shown that women do want to be sexually active and maintain sexual activity in their 60s, 70s.
Of course, yeah.
So it's important to know that, that's not okay and that there is help.
Okay.
Only recently we have started to prescribe medications like testosterone. For low libido. And that's, as of now, it's the only indication in the United States for women with low libido.
When you say indication, that means something you can prescribe?
Correct.
Okay, gotcha.
It has to be prescribed by a provider who is familiar with testosterone
and it's not
prescriptions.
enough to give you like chest hair. It's just a little bit, right?
As of now, testosterone is not FDA approved for treatment in women, which means that we don't have the medicine that is appropriately dosed for women. So we have to go to what we have for men currently.
Are you kidding
but we
me?
have to adjust the medication. It's a little bit
do.
cumbersome, but it's used for women as well. It's like a 1/10 of the dose.
I know it's more difficult to study with female bodies because we have hormones and we're more complicated, but it doesn't mean that we shouldn't do it. That's all I have to say about that.
Absolutely. We should. And we should talk about it because, like I said, a lot of women suffer in silence.
Yes, of course they do. They get, you go to the doctor and you bring this stuff up and they're like, well, let me just give you some birth control. That's like the only thing you get prescribed. Or they're just like, well, that's just part of aging. Like, there's no help or there's no hope. There's no validation. It's just... Yeah, it's not good.
You're right. And I think that as we talk about it and as our patients demand more, and as women, we demand more for ourselves.
Yes.
I think that we're having, even at the government level, we're having more resources applied to study in menopause.
Good. That's good news.
Yeah, it's great news.
Hormone replacement therapy. Will that increase your desire to want to have sex?
Hormone replacement therapy does help with, the genital and physical part of the desire to have sex. It does improve it. But when we talk about, as I mentioned before, the desire can be also associated with other factors. Like, do I not have a desire because I have pain? So if you have pain, then we can correct for the pain,
right?
Which management can be different. It can be no medications or medications.
Yeah, like pelvic floor therapy.
Pelvic floor therapy.
Which I've recently been through, and it is it's a very unique situation you find yourself in while you're in therapy, but it's awesome. And it works.
Absolutely. And, decreased estrogen production, like I said, affects the pelvic floor. So is it because your muscles are hypertonic? Is it because they're too weak? So addressing that can be important too. Because just hormone replacement therapy is not the answer to all.
Yeah.
So it's more of a complex discussion, and it needs to be addressed with a provider and not as a side note at the end of the visit.
Yeah. Yeah.
Oh, by the way, I have low libido.
Well, and you bring that up. Can you make an appointment with you just to ask questions about menopause and your symptoms as opposed to like getting a PAP?
Yes.
Okay.
And I actually, since there is more awareness with celebrities talking about menopause, more books out there, I've had a lot of women come in just to talk about perimenopause and menopause. And I love talking about that because I can just dedicate my time to that.
Yeah, exactly. See, I think that's one of the biggest takeaways I've had by doing this podcast is you can just make an appointment with your provider to ask questions.
And we recommend that.
Yeah, well, I'd never heard that before until I started doing this. Okay, well, what symptoms have you had brought up to you as a doctor? I know we have hot flashes, and we know we have the irregular periods, but what other things are women saying, I don't know what this is. Could this possibly be perimenopause, menopause?
Well, sleep disturbances is very, very common. Anxiety is very, very common. Those are like major factors for women because, as you can imagine if you are not sleeping well, it can have a downward spiral effect, and it can affect everything in your life. Sure. It can affect your productivity at work. It can affect your relationship with your partner, with your children. But also some random things that or at least that they consider random is joint pain.
I was getting ready to ask you about joint pain because I swear to you, every month, the week before Lady Time's supposed to come, my elbows kill me and my wrists get weak.
Yeah.
So weird.
It is, because we know now, and there's more research ongoing, and actually Duke has some research ongoing for joint pain in perimenopause and menopause. But yes, we do have estrogen receptors in our joints, and it's not necessarily arthritis because of age, although that can affect some of it, but it's actually hormonal.
That's crazy. Everything's hormonal.
A lot of it is.
Yeah.
A lot of it is. And I think that we're just now talking about it.
Right.
And that's why, oh, wow, it's hormonal. It's just the changes that we go through. We need to make sure that we understand our bodies, to make sure that we understand that this is normal, but we can do something about it.
Well, that's the most important thing, is once you realize there's a problem and you're not, that when you correlate it to your body losing estrogen, you can fix it.
Right.
Yeah, you're not making it up, which is what you've been told for so long.
Right.
Well, I don't know. You hear I don't know so much at the doctor sometimes as a woman.
You're absolutely right. And, I am guilty of that too in the beginning of my career, because I did not get much of a training in menopause.
Exactly.
And so, because there wasn't much. And until you go outside of it, and then you're finding your patient population are asking all these questions, and you have to go in and research it yourself, because you just didn't have this in training. We focus on, there's so much research in reproductive health, and which is good. We want to have that.
Of course you need to know about that
pregnancy, we want to know that, of course. But when you think about spending 40% of your life in menopause, and trust me, if you live long enough, you will get in menopause. That's inevitable.
Yes.
Right?
Yes.
So if you are going to live long, which average women reaches maybe age 84, 85. Yeah. 40% of your lifetime is in menopause. So why should you be miserable? Why shouldn't we demand more?
Yes. Yes.
And
preach.
we are. And we are. And we are. And we are. Yes. So which is really, really nice to see.
I agree. And I think even from the last time we spoke about menopause, I feel like the awareness has gotten even louder.
Yeah.
Naomi Watts, and there's someone else on the tip.
Halle Berry.
That's it. Halle Berry. She's really big on it right now. And I just think Gen X is coming through, and just like they've always done, they were just like, this is BS. What do you mean you don't know about my body? You know? So I love it. And we're doing our own part right here.
We are.
Okay, now we're on to listener questions, and these are always fun. So here we go. Not only does sex hurt, but my vulva and labia seem to be irritated at times. Just wearing underwear leaves me feeling chafed. Is this due to hormonal changes?
Absolutely.
And is that because there's no collagen in there?
The elasticity decreases, and we talked about that fat cells also decrease in the labia, which make friction even more uncomfortable and painful. So a lot of times women will start or stop wearing certain clothing because of the discomfort. We'll stop exercising, like bike riding especially, and I've seen that. The other thing that happens with us women in our midlife, there are some certain skin conditions also that start to appear that are autoimmune conditions. And so it is very important to address these with your doctor.
Like eczema, psoriasis?
It's lichen sclerosis, lichen planus. They're skin dystrophies, we call them, but autoimmune skin irritation.
What does it look like? Just like
it causes hypopigmentation, so certain areas will look whiter than others, but prolonged or significant autoimmune conditions can cause scarring in the vulva as well, where the labia will fuse together, and it causes a lot of abnormalities and discomfort.
Oh, yeah. So don't ignore it.
Don't ignore it.
Yeah.
Do not ignore it. A lot of times, though, women will also mistake this for a yeast infection. Because, in our lives, we may have had one or two yeast infections, so it kind of feels irritated. So they treat over the counter with Monistat. I've had multiple patients that come to me and they're like, I I've been trying the Monistat over the counter and nothing seems to work.
It's not a yeast infection.
It's not a yeast infection.
Yeah, remember, you're not a doctor. You know the things that you know, but there's a whole lot of stuff you don't know and that it could be.
Right.
That's something I've learned over the years where I try to self-diagnose and I go to the doctor and it's something I'd never heard of because I'm not a doctor.
Right.
All right. It seems like more women are experiencing menopause earlier than in previous generations. Is it true, or are we just talking about it more?
So we don't know. I mean, I think it is because we're talking about it.
I think so too. I mean, it makes sense.
Regarding the symptoms, we're learning more about perimenopause. We're learning about how to treat perimenopause. But regarding aging, it's just that we're collecting more data.
Yeah.
And the more data you have, the more accurate you become.
Okay. Now, this is something that my producer, Anita, and I are very interested in. It's a service you can now receive at certain fancy spas. It's called the O-Shot. Have you heard about this?
I have heard about that.
Well, let me read it so that people listening know what this is. It's called the O-Shot, the Orgasm Shot, and it is a non-surgical treatment that uses platelet-rich plasma to rejuvenate and enhance the G-spot, clitoris, and labia. It's supposed to increase the sexual function and appearance. It's supposed to help with vaginal dryness, low libido, urinary incontinence, and it is injecting PRP into specific areas of the vagina, and that's supposed to stimulate unipotent, I don't know how to say this word, stem cells essentially, generating growth factors to promote tissue growth and rejuvenation. First of all, does that make any sense to you? And second of all, should we go out and do this?
So there's a lot of products out there that promise the world, first of all.
Like snake oil?
Snake oil, one of them. But the fact of the matter is that, the G-spot or the orgasmic nerve endings can be different for different women. Some women can achieve orgasm by external stimulation, while others by internal stimulation or both.
Okay.
So to claim that me giving you an injection at a particular area is going to be the end all of all your problems, I think it would be a little bit too enthusiastic for me.
Too enthusiastic. I like that. That's very diplomatic.
So the idea with the PRP is, like I said, to stimulate your own cells. We use it for hair growth. We use it for skin stimulation in like our face. So there is certain indications for that, but I think that for the G-spot, it's too promising. So.
Okay, all right. Well, there's that. So do it if you want to. Maybe it'll work for you, but if it doesn't, don't be surprised.
Yeah.
Okay. Well, I think that's the end of my questions this time.
Okay. Well, that was quick.
I love having you on. You're
thank you.
So easy to talk to.
Oh, thank you. So are you.
And well, thanks. And we'll probably have you on again, so don't be a stranger.
Okay. Sounds good.
I love Dr. Kennedy, don't you? You can find Dr. Kennedy at wakemed.org. We are so appreciative of you listening to this podcast and watching it on YouTube. We would love it if you left a review in your podcast app. It really does help people find us, especially if you give us 5 stars. Or you can leave a comment on YouTube as well. Tell your friends, share the show. Like Dr. Kennedy said, the more we talk about it, the more money goes towards research, and menopause and other women's issues become forefront, and that's what we're doing on this show. So, that being said, see you next time.